Welcome to the Pharma Forum podcast. This is web editor Nicole Raleigh, and I am live on site in Cornwall for Anthropy 2025, Rebooting Britain, once again held at the Eden Project. And with me is Sebastian Vaughn, CEO of Phytome Life Sciences. Welcome, Sebastian.
Hi, great to be here.
So you and I actually spoke at the last Anthropy, which was held in 2023. We did have plans to record our conversation from then. That didn't turn out, but here we are today. So it's fair to say that quite a lot has happened since then for your company Phytome, but also for Anthropy. So if we turn to the panel that you were just on here today, Revolutionary Thinking for Mental Health, sponsored by Adelphi Group, needless to say, existing approaches to mental health are not answering the lifelong mental health problems that many of today's young people live with. And mental illness affects increasing numbers of young people. But society, as was discussed today, has a shared responsibility for their future. Indeed, what was highlighted in today's panel was that if we don't address the mental health of young people, that mental health problem or challenge will go into the adult population of tomorrow. So, Sebastian, can you perhaps sort of sum up and discuss from the panel how we can rethink models of care when it comes to mental health, sort of the steps that can be taken to improve even identification of mental illness, as well as what can be done in terms of intervention and, importantly, support?
Yeah, well, listen, it's great to be here. I was just part of this incredible, prestigious panel, actually, here at Anthropy. It's an environment where we're able to address issues like this, where we sort of can really speak truthfully about these issues and break them down, not only with a great panel, but I have to say one of the unique things about Anthropy is the fact that the audience is actually an incredible, multidisciplinary audience that ask incredible questions. And we really get some innovative conversations and quite exciting solution conversations as well that come out of this, not just in the hour that we've just been speaking, but actually the relationships that go on beyond that and start to form out into real action out there in the real world. If I was to sum up the conversation that we've just had, it was really, the nub of it was recognizing that mental health is not this binary issue of you have mental health or you don't. It's not about just the diagnosis. It is a continuum of a lifelong sort of management process. And actually, Shri, one of the key members of the panel, she mentioned actually that this whole segmentation, if you like, and the necessary need to segment out the different types of mental health condition that we have, and so that we can actually more adequately recognize not only how we treat them as a population health issue, but how we can actually go forward and treat them from a more personalized perspective, because everybody has different modalities and approaches to accessing care. Some examples were given around technologies where apps have been created, specifically around supporting certain categories of the workforce with suicidal ideation. And from that point of view, I think it really points to a future where we can recognize the challenge. I think the opportunity is to realize quite quickly that the healthcare system on its own is not the only point of delivery of this revolutionary service that we started to think about today, and that there's a really strong community ethic that's going to come in specifically with our young people around the prevention and, if you like, the onset of these conditions. The young evolving mind is particularly sensitive to trauma, to experience. It's a rapidly evolving and growing thing. And actually, as what we see and what's sort of coming to bear as we move forward now is recognizing for the first time that actually there's a whole process that we need to go through with young people to really recognize some of the simple community-based solutions that we can put in place that should really be delivered with governmental support, but by the local community.
Absolutely. I think you did a brilliant job of summarising the entire panel then. So let's sort of break it down slightly. So first of all, you mentioned that Shri, who's a consultant psychiatrist and is working with her own startup with AI and health tech, she mentioned that it's necessary not just to broadly umbrella all mental health together. So we have different, let's say, categories, for want of a better expression right now, of mental health. So you've got your anxiety and
ADHD,
PTSDs, that sort of stuff. And then you've got the more psychosis-based mental health, like schizophrenia, for example.
Correct.
So let's, for the purpose of today's conversation, focus on the first category, which is what was discussed by and large in the panel. And indeed, we had Charlotte from Mental Health UK and also Sarah from Mind, and they spoke to the necessity of not just supportive charities, not just government, not just the health service being there for young people and providing care and a listening ear even at that base level, but also the necessity of parents, of teachers to be trained in that regard. What are your thoughts there?
Listen, I fundamentally agree with a few points that were raised. One is that one of the examples that was given was around someone with a teacher, someone who had extraordinary mathematical capabilities that went on and wanted to develop themselves as a teacher. And actually that a lot of those people are not being given the skills to treat an increasingly challenged group of young people with their mental health. Young people are becoming more and more aware of their mental health, which is actually really important. We shouldn't be burying this issue, but then we should actually be providing the teachers not only with the training on how to manage that and to support these young people, but also the ancillary services around them where they can actually seek support to enable children to access the types of conversations and solutions that they are readily available, actually. If they were able to understand how to deploy that from the point of delivery of the actual teaching, it could actually become a point of healthcare in many ways. The classroom could eventually become a point of healthcare for those young people.
Absolutely. On the diagnosis point, what might have been surprising for some people in the audience was this going against the trend, as we've been reading in the press recently, of this word overdiagnosis or this increase in mental health issues. Quite the opposite. For example, Lauren, who herself is a consultant clinician in the NHS, she said, this is just the fact that people are being diagnosed. They're going for the diagnosis. And indeed, herself, Charlotte and Sarah were saying that not enough people have yet been diagnosed. In other words, the stigma has been detached from mental health, which is excellent.
Correct.
But the question remains, why the prevalence? So this becomes a societal question. And if we go back to the community ethic as a health provider, a care provider, you yourself mentioned that there should be this shift from the notion of healthcare, i.e. the sort of National Health Service and what's been deemed sick care, to healthspan. Can you elaborate on that for our listeners?
Sure. So the concept of healthcare really has and remains born out of a Victorian model of treating infectious acute diseases. And our approach is really still embedded in that point of view of going to the place with the issue, getting diagnosed, having a treatment delivered to you and going away again. And that really isn't a model of care that works with something that is, as I said earlier, is a continuum. This thing is actually, it's always where am I on that scale in these issues like ADHD and anxiety disorder. It's not a binary issue. And so from that point of view, we need to rethink, in my position, and actually largely the audience and the panel agree, is actually being able to create this holistic model of health span, where actually what we're thinking about is almost a quotient of our well-being over our full lifetimes. And so we're really looking at what are the indicators of a thriving life. Yes, Wes Streeting made some provocative comments recently, and I think it's important to put them into context of a lot of the different things he was probably trying to deal with. I think the country does have a productivity issue, and one of the points I made on the panel actually was I would really love it if we stopped associating mental health with getting back to work, and that's what are we trying to achieve? Are we trying to put people back to work? And I believe purpose and great work is, it gives us a lot of features of purpose and well-being that drives us forward. But ultimately, I think there's a real opportunity here to start talking about what helps us thrive as human beings. And that plays into the idea of longevity. So we are all living longer, and therefore we need to live better and live well. And there's some extraordinary pieces of work that are starting to happen in cities, actually. I think Manchester is one, where they're talking about strategies to apply living well and live well strategies into the community, so that they're actually more adequately and more actively managing the balance between health span and point of care delivery of when you are sick. Let's say you've broken your arm, you definitely need to go to the hospital. And so technology has a huge role to play in that. Artificial intelligence was mentioned today as having an important part of it, and community solutions for the younger people. For example, as youth centres were mentioned, and youth centres were hugely prevalent. Even when I was a kid back in the 90s, most people were associated with either, and they might just play sports there or they might hang out, but ultimately community. We are increasingly isolating ourselves, whether we like it or not. The phone and social media is giving us a virtual version of community, and I'm of a certain era, and so I relate to a phone in a different way to a young person does today. And then actually what I think we need to do as adults working in those healthcare systems or developing solutions for them as technologists is ultimately listen to the young people properly, to understand how they view that technology and that accessibility and what they want it to be able to do for themselves, because they fundamentally see that technology in a different way than we do. And therefore, I think one of the most important points that we actually got to on today's panel was actually around, why are we not seeing more young people sitting at the table discussing the solutions that they need? If we get one thing right out of today and we make one change, that would be mine. It would be to put them at the table, supporting the dialogue for the solutions that they need to take forward, because they will then buy into them. They will understand that they're correct for them. And actually you will see that cultural change that we need to achieve over, a long period of time. This is not an overnight solution, but it's about a systemic change to how we are developing our culture around mental health.
Thank you for that, Sebastian. Again, a lot to unpack there.
Indeed, yeah.
But again, you summed it up, and you didn't just sum up what was discussed within your own panel on mental health, sponsored by Adelphi Group today, but general themes that have been prevalent at Anthropy 2025. So there has been this call to action for Anthropy 2026 for young people to actually be on the panels that are being held here.
Yeah, brilliant.
Because what Anthropy is all about is action. It's great to spark the conversations, to look for the solutions, but essentially what comes next is what Anthropy is focused on also. It is the active component. We are all individuals in attendance, but we are all agents of change. So that's one theme. Another theme which you brought up is systemic change. And this is being repeated again in different terms many times, but it is system change that is needed. Now, we've been discussing this aspect of community care, social care, alongside healthcare. If we really sort of tunnel down now into what can be done preventatively, I mean, it's been mentioned on both Adelphi panels. Yesterday's panel was on prevention. This need to look at change in terms of prevention at primary, secondary, tertiary levels of care. So if we think about perhaps novel approaches, and I'm thinking now going towards your work at Phytome, so can you share from your perspective novel approaches that could be possible interventions and help show promise towards this more holistic, less productivity mindset, where we are human beings who need healing in order to be effective human beings for the planet. Again, Anthropy is for sustainability, no planet, no people. Can you tell us more?
Yeah, so just to give people some context, Phytome itself is a pioneering company based just sort of 20 miles away from the Eden Project, where we are sort of enjoying Anthropy this year. We're really focused on understanding how you unlock the potential of plant-based medicines through the process of leveraging the biotechnology that's available today. What we're really saying is we need to be able to develop scalable approaches to producing these medicines in standardized ways that can go through all of the clinical trial processes that any pharmaceutical drug product would, identify where there's efficacy, identify where there's potential toxicity, and also the ranges in which these, and the, if you like, the total package of care of how these interesting medicines can be delivered. And it's not the same, actually. What I'm really passionate about is the idea of integrative care, where we are potentially working with a medicine where there's demonstrable efficacy around a particular issue, whether that's an addiction, a PTSD, or something in those sorts of categories. But actually we're wrapping that in a holistic approach with, for example, talking about psychedelics, psychedelic-assisted psychotherapy. And there's incredible, it's sort of sits you down on your bum sort of data coming out of America around the MDMA trials in treatment-resistant depression with veterans. These are people who have essentially been treatment-resistant for over a decade. And fact check me later, but I believe the regimen was 2 treatments of MDMA over a period of 12 weeks with 40 hours of psychotherapy. And what they were showing was nothing short of extraordinary from a pharmaceutical point of view. They were showing 70%, if you like, quote unquote, cure. People were no longer suffering from treatment-resistant depression. I believe they also had good feedback on either 6 or 12 months later, these people were still showing really strong responses. They were still out of that depressive state and they were moving forward. And so from that point of view, that's nothing short of revolutionary. Now, as I understand it, the FDA have asked them to go back and do another phase 3 trial. Now, okay, they probably could have moved forward, I suspect, with something where they put further sort of caveats into how these medicines can be used, and they could have moved more quickly. But my understanding of the group that is developing that originally out of MAPS, they will go and do that trial and they will demonstrate the evidence that is required, and they will keep moving, because that's been the history of how they've been developing that solution. But fundamentally, I think what's really, there's also great data actually recently out in Nature Medicine around using ibogaine as well with similar types of patients. Now, the broader context for me, moving away just from being a pure rational data-driven scientist, is maybe what was actually people were getting to in the 60s and the 70s, work that was going on largely in America. They were really demonstrating the value to human healing of what was then coined a mystical experience. And there were some really revolutionary trials. They were working already on addiction back then and having incredible results with largely, I believe it was LSD. But here we are again. You know, this work was then picked up again by Roland Griffiths, who was originally, I think he was a caffeine researcher and then into sedative hypnotics. But he got into that area because he actually, it was nothing to do with medicines themselves to begin with. It was the fact that he discovered meditation and he found huge benefits from it. And so there's been lots of conversation today around those types of modalities, which requires no pharmaceutical intervention at all. So things like CBT, things like meditation, and a lot of Lauren actually talked about, you know, the huge success of using CBT in insomnia. And then if you play that out into the healthspan story, she then went on to explain how that has a very positive correlation with reduced morbidities, i.e. Less onset of other complex chronic diseases, which chronic sleep disorder can start to induce a pathway of disease. So to me, it speaks to a future where we're not trying to adjust our young people to a culture where it actually drives potentially, I think we might need to start to swallow the pill that the way we live drives disease, to actually talking to our young people about how do they want to live, getting them to buy in or actually tell us that storyboard, explain it to us, And actually, we, a lot of what's been spoken about at Anthropy, and John O'Brien repeatedly is sharing this, is about his era, his generation received, this incredible social contract that has actually enabled the boomers and others to really have a thrive. They've had a life where they feel like they've had prosperity, they've had, a really good lot. And actually, that in a very humble and honest way, they're saying we feel we're handing the opportunity over in a much less attractive state. And actually, they're wanting to speak to the young people now. And this is what I think John's talking about. How do we really integrate? There's an incredible emerging leaders opportunity here already. I think John mentioned there's around 230 young people here in the emerging leaders group. But how can you have more of them on the panels, part of, even more as part of the conversation, driving change? And actually, I think that's an awesome idea. But coming back to our panel, for me, it's about what is the future of how we want to live? What is a thriving human future? What are the future economies? What are the jobs that people want to do? How do they want to do them? And I think we are all essentially biased to our era, whether it's musically, technologically, how managerially, how we think about work, what is the contract with work and life, what is boredom, what sort of things cause boredom in different groups of people. And so from that point of view, I think really when we're really focusing on young people, we've got to listen to them in a whole new format of actually not just saying, oh, tell us what you think and we'll go make the decisions. Actually, they should be the people who are part of the decision-making process.
Absolutely. I want to focus on that listening aspect in the sense that what's also been mentioned a fair bit at Anthropy, including the panel, is the influence of geographies, of demographics. So Lauren gave the example of studies in East London and North Devon and what is provoking mental health issues in young people in those localities. For instance, in North Devon, it was about job prospects, which, as most listeners will entirely understand, is totally different to issues in East London. Yeah. So to sort of summarize the influence, whether positive or negative, in addressing care from a geographic point of view or a cultural point of view or a socio-economic point of view, what can you say there?
Well, it speaks to personalisation, doesn't it, really? Let's be honest. You can go down each layer of resolution we go through, we end up with, well, who's the human being and what's their background and what makes them tick. And yes, there are certain commonalities at a global level, a country level, a regional level, town level even, the nuclear family level, and then down as individuals. And so this is where I think technology really offers us this unique opportunity, because it's very difficult. Listen, government deals and has to deal in public health countrywide issues. And another consistent issue that I've been hearing through the Anthropy sort of couple of days is actually around devolution and hyperlocalization of capability, of ambition, of that can-do attitude. And I think it's particularly difficult in healthcare or public health more widely, because there are certain aspects of it that are so much more efficient if done at a countrywide level, and yet then you have this significant opportunity, I guess, for too many people to fall through the cracks because it doesn't actually fit who they are. There was a young lady in the audience who sort of explained how she had really gone the extra mile and done everything, but still at the point of care, she was finding culturally that the offering that was being put forward didn't actually work for her. And so that's really difficult to do at a government level. And that's where I believe, technology can really help us create hyper-personalization as well. And I think we should be careful to if you like, try and devolve all forms of healthcare and social intervention at the local level, because it's again, you might exacerbate what's maybe called the postcode lottery. Some areas will do it incredibly well, some will be mediocre, and some might be really awful. And so I think really we've got to think carefully, and maybe these are some of the issues we need to move more slowly on. But I definitely believe that everyone cares. I don't believe people don't care about this issue, and therefore if we can give resources to listen, we're not going to deliver that form of social contract with our young people and our communities if we're not thinking about the individual and about hyperlocal contract with them, where there's resources available that are being given from the central government to enable them to create outstanding community again.
Nicely put. So let's think about cross-sector collaboration. The panel itself was a pretty diverse group. There was yourself, some clinicians, some charities. Could cross-sector collaborations be the key to changing practice and influencing policy?
Yes, in a one-word answer, I think yes. So I grew up as a scientist at Imperial College, developing medicines in a translational research environment. So I'm acutely aware of the power and the benefit of a multidisciplinary approach. So I'm a believer in that methodology. I think it enables new thinking. I think it reduces blind spots on serious issues. And therefore, I think it's really important that psychiatrists, for example, work with technologists and work with actually, let's just call them for the moment, let's just keep it generic and call them young people who we might be developing the tool for to create a scalable, personalizable mental health intervention. And so from that point of view, I think it's absolutely fundamental now that we do that both technologically, at point of care, with the community, and with the pharmaceutical companies. Everybody recognizes there is a dearth of really good pharmaceutical tools to address mental health conditions. And so actually there, again, historically and even now, pharmaceutical companies, it's a very difficult place to play politically, and from a regulatory point of view, they're very sensitive. But I do know that people that I talk to, they want to get that right. And so from my point of view, we need to be progressive. We need to think about how we can put those groups of people together to identify these new ways of doing things. And I think it will be best served if we put them in the room together with a clear outcome that is largely driven by a vision that sits with I don't want to say the word patient, but sits with the user of the intervention that we are trying to develop. Because mental health is a continuum. I think we should absolutely move away from thinking of them as patients. We're human beings, and so I think it was Sri that said right at the end, there's no health without mental health. And so we just need to put ourselves in it. We need to reframe it that we should always be understanding how we live well, and accepting that our mental health is always, a plastic, a volatile area of opportunity, and we might not be diagnosing ourselves, but we might feel more stressed, and maybe we've got a little bit of insomnia for a period of time because work's challenging or something like that. Or in young people, they're stressing about getting their first job, or maybe sadly they're being bullied at school, or they're finding their work, their mathematics really difficult. We really need to be able to work at that level of resolution, but with tools that can be delivered from the very highest level and then scalably resolved down to the level of personal individual usage and fitting it to their individual needs.
It's so true. I want to rewind slightly to the pharmaceutical aspect. So I spoke with David Gillen of Norgine yesterday, who was on the prevention panel run by Anthropy group. And he debates anyone who will say that pharma is not about prevention, it's about addressing the sick side of things, making medicines, and gives as example vaccination. So Lauren brought up today, I believe it was Lauren, that the funding for mental health is greatly lacking, and that if you were to turn the tables and take the funding for oncological research and apply mental health's level of funding to it, there would be uproar in the nation. So when we think about incentivizing cross-sector collaboration and bringing pharma to the table with communities, with charities, with young people, how can that be done? I know this is putting you on the spot, Sebastian, but just...
Well, I'll try my best.
Yeah.
I'll try my best to give you... listen, let's caveat it. It may well contain some of my individual perspectives, but I'll try and keep it as broad and open as possible so that I'm not I'm not speaking for the panel and certainly not for the wider audience. So there was a really enjoyable and wide-ranging mix of ideas, all positively pointing towards, serious areas of opportunity. So yeah, as a young scientist, I developed medicines for cancer. So, and the oncology space not only is it incredibly competitive, cancer is ultimately hundreds of different diseases as well, and therefore there's the potential for the requirement for hundreds of different medicines to address these different conditions and treatment modalities that are required. And therefore, from a commercial perspective, that's incredibly attractive as well. And so there's a history actually of cancer, and also the emotiveness of it as well has been incredibly. It's burned into our consciousness, I think. And so cancer is both incredibly well funded from a grant and a charity point of view, but also from a private and commercial point of view. There's a huge industry around development of therapeutics for the oncology marketplace, should we call it. And mental health, I think, is quite different. And I listen, this is just my own perspective, but I sit and I sort of think about that, and I see it as because actually that primary cohort that we were talking about, the ADHDs, the PTSDs, so on and so forth, they're really amorphous. They're a grey mixture of things that largely either we don't like to talk about, we don't want to go and talk about them. We might suffer in silence, and they're very different then from something like an Alzheimer's, where we can sort of follow the model of what something like the cancer development pathway is thinking about. Is here's the problem, here's the solution. It's a therapy, it's a drug, it's a molecule, and there's a pathway. It's a well-trodden pathway for charities to work with, for pharmaceutical companies to work with, and for grant bodies to be able to finance as well, because there's clarity. And so I think, from my point of view, in the future of where we go with that group of that, I believe it's rapidly escalating. I get the point about diagnosis, but if I just take what I see anecdotally and largely maybe what I feel anecdotally in my own life around technology usage or stress and other things, I believe it's on the rise, as well as there's a rise in diagnosis. That's my gut feeling about it. And so I think really what we've got to do is recognise, and this is another big objective that Anthropy and actually Adelphi really consistently push, is actually patient-centred and patient-empowered charities, those that are really talking and bringing the patient voice to the centre of the conversation. And I think that's what we heard today in our panel, was put the young people in the middle of the conversation, listen to them intently, but then also put them in the decision-making process as well. Go that one step further. You're not just surveying them, they are part of the process as well. And that level of empowerment will drive the ability to generate the funding requirement, in my opinion, over time, and it will take time, from all of the different sectors that we require funding from, to actually start to resource that issue properly. And I would say from the outset, we shouldn't be looking to the sort of the healthcare model to be the sort of the point of delivery. And so being able to put all of those different organizations in the room from the get-go, we need a contract where we understand how we put technology, possible therapeutics, and the patient in the middle of that, and actually the social contract around it, which might include a therapist in some situations, or a community-delivered service like a youth club that was mentioned consistently as being an incredibly powerful source of purpose, community, and other issues that that are softly dealt with through those incredible places.
I think that summarises the conversation quite nicely, Sebastian. So I will leave it at that. Let's see what action comes next. It's been a pleasure.
Likewise.
And so that concludes another episode of the Pharma Forum podcast. You can find more information about this episode, including a download link and information about previous instalments at pharmaforum.com/podcasts. The Pharma Forum podcast is also available on iTunes, Spotify, Amazon Music, Podbean, and pretty much wherever you get your other podcasts. Just search for Pharma Forum and press subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us as well on X or Twitter and LinkedIn at Pharma Forum. That's all for now. Thank you for listening.